Welcome to Mededia. This is Tariq. Gonna do another mock interview of one of our Mededia mentees, Dr. Reem Shakeel. Hello, Dr. Shakeel. How are you doing?
Hello, Dr. Tariq. I'm doing great, and thank you for giving me this opportunity to interview with you. How are you doing?
Good, good. Thank you. So go ahead. Tell me briefly a little bit about yourself, please.
Sure. I am an international medical graduate from Pakistan. I was born and raised in Saudi Arabia before I moved to Pakistan to pursue my passion as the first doctor in the family to start medical school. And I did my internship after medical school. After my internship, I took some time off for like steps, and I was able to come to US early August when I was given the opportunity to work with doctor in the internal medicine family practice. So I was an observer there. And then after that, I did my externship at a family medicine practice. So it has been a very good journey for me up till now. And currently, I am working as a medical scribe for an online company. So I'm also studying for step 3 along with that. During my time off, I just go to a hike and just go for a long drive with my family. So, it's interesting till now. Thank you.
Okay. Well, thank you for that. So where are you currently right now? Are you in Pakistan?
Currently, I'm in New Jersey.
Oh, okay. So what brought you in to New Jersey? You have family there?
Yes, I have family here. My sister is living here, so I'm living with them.
Oh, okay. So when did you immigrate?
I immigrated back in, I think, 2000, early 2000s, 2002. But I could never formally like come and live here because of family differences, and like there were some issues going back home in Pakistan, and we had to resolve those. So this is the time when I can, come here and stay with my family.
Okay. So why not go to med school in US? Just curious.
As I said, that we had to stay back in Pakistan. Me and my mom had to stay back in Pakistan to resolve the legal issues that were going on regarding our house. So, because I was the youngest in the family and I had to stay with my mom, and that was the only possible route for me to continue my medical education in Pakistan.
Okay.
But
All right.
nevertheless, I do not regret anything that has happened till now.
Okay. Why internal medicine?
Oh, that's an interesting question. Thank you, Dr. Tariq, for asking me that. I was very much attracted towards internal medicine during my clerkship years because I felt like internal medicine was the point where I could completely rely on, my knowledge, and I had the tools from like studying anatomy, physiology, pharmacology. Everything was there in my mind, and just diagnosing every disease, every case, every new patient was a learning experience for me. And I really like got entrenched by the whole idea, and seeing my attendings and seeing my residents do that every day, it really inspired me.
Okay. And why not train in Pakistan? Is that because of your family status?
Yes, my majority of my family is here, and like I want to, spend more time with them because having living apart for so long, I think this is the perfect time for me to, really settle in and start my residency training here.
Okay. I see in your CV you mentioned that you worked at Child Life Foundation in Karachi. Can you mention a little bit? Can you tell me a little bit about that experience?
Sure. So that experience is very close to my heart. I think that experience has really, taught me a lot of things. That experience was based at a at a pediatrics emergency in a tertiary care hospital. It's a completely nonprofit organization, and the way they have set up the system was very exciting to learn about. They told us how they started from like one setup, and then they have expanded to a huge setup through across many cities. What my role was there was as a volunteer. I had to, I was assigned different tasks on different days. We would attend morning meetings, and then I would be off to my task as a ticket. I would have to give tickets to the patients coming in. There were small tasks, as well as actively participating in the management that was going on in the resuscitation center, where very sick kids were coming in, and if they needed CPR, they allowed me to do that hands-on CPR. So it was a very interesting experience, as well as I was able to rotate in the neonatal care as well, and that was a whole different setup of all the things that were going on to manage the jaundice patients or premature kids. So yeah, that was my experience.
Okay. And I see you worked in US as an extern, as an elective student. So you had in total, I believe, 4 months of electives and externships, right?
That would be 3 months.
3 months, okay. So you worked in New York, you worked in a bunch of places in New Jersey, and yeah, two rotations in New York. So among all the rotations that you did in America, which one was the best? Which one do you think you liked the most, and why?
That's a difficult question. I think all rotations have a special place in my heart. I have enjoyed being inpatient and being in a very pressured environment, and seeing all those things and seeing the dynamic nature of being in a hospital. So that experience was also an enlightening one for me, and was more comparable for me. As a medical student, I was going into more inpatient setting back in Pakistan, so I enjoy that stuff. But I also think that the inpatient setup, where I was able to talk to the patients on one-on-one, and counsel them and tell them different managements that they're going through, or different tests they need. So that slow-paced environment also really allowed me to connect with the patients, and I really care about patient-centered approach. So I think that I would favor more of like inpatient setting, as as a thing that I enjoyed most in my journey through the US
So
healthcare
you prefer
system.
setting? You enjoy working in inpatient setting more than the outpatient setting?
I enjoyed it more in the aspect that the
Sure.
patient interaction was very lively, and just more, I could dive more into that and more into
Okay.
their history. Mhm,
So I'm a little surprised, but in your personal statement, you mentioned that you are specifically interested in endocrinology.
mhm.
So
Yes.
endocrinology is typically, as far as I know, mostly outpatient.
Mhm. I understand that that is like what I have mentioned, but obviously I want residency for me, the residency period to be a deciding factor for me, where if I want to do more inpatient or more outpatient. And I'm really looking forward to how I will evolve in these 3 years. But definitely endocrinology is something that I want to pursue, and I think residency is the main deciding factor if I really want to keep it towards inpatient or outpatient.
Okay. What's your biggest challenge been, and how did you overcome that?
Dr. Tariq, that's a very interesting question. I can recall a moment when I felt that I was, a period of struggle for me would be the time during fourth year. We were in a modular system, in a semester system, where we would have our exams every 6 months, and we would be assessed, in pieces. And all of a sudden, it was announced after one semester that we will be having annuals, and that was a completely new system for us. None of us knew how to cope with that. But what I did was that I tried to maintain my calm, and I was like, okay, I'm gonna go head on, and however I have to tackle this, I'm gonna make a schedule for myself. So I remember I was sitting down with my friends and discussing how are we going to tackle this new system, annual exams, where we have to take the exams for the entire year all together at once within a period of like 2 weeks of gap. So we
Okay.
were able to make a schedule, and we were able to do perfectly fine.
Okay. What do you think is your biggest strength?
I think my biggest strength would be that I'm able to communicate with a lot of different people, and that comes from having lived in multiple different regions of the world. I feel like I am much more receptive, and people are much more receptive to the things I say because I have lived in a diverse group of people. And I guess I have that ability to, really understand what their perspective is. And I don't create, things in my mind that this is what the person is trying to say. I try to listen to them and be very, open. So yeah, I feel like this is my biggest strength.
Okay. And what's your biggest weakness?
My biggest weakness, I guess I would have to say that I'm not much of a, like when I'm doing something, I end up doing I do it continuously that I forget, I lose track of time and I kind of just burn out myself. But I'm really trying to work on it, and I'm trying to schedule myself and not let myself just go loose and keep on doing working or studying. I'm trying to create a balance in my life and schedule out everything, when I study, when I work, and when I take time off.
Okay. And why do you why you should be selected? We have a bunch of different applicants. What sets you apart from all of them?
Yeah, I think that a lot of the applicants are capable and they are competent enough to be selected for your residency program. But what I might bring to your residency or add to your residency is my diverse, my diversity. And I feel like I am the kind of person that is able to cooperate so well with everyone. And I also am a very ambitious person, and I try to work hard and try to prove myself, and that drive and that fire is something that will really add to your team.
Why do you think diversity is important?
I think diversity is important in the US because we are a group of we are a whole nation of people that comes from different walks of life and different countries, and America is huge, and we have to cater to all these people. If we are not represented well, like if the doctors are not diverse, I feel like the patients will feel like excluded, and if they feel like this doctor is very much like us, they're going to feel heard when they come into the clinic or they come into the hospital. So and also when we sit down and discuss on of different forums, we need to have a voice for each group and each color of person. So diversity really plays a role in even deciding what kind of symptoms we have to look at. Every skin color has its presenting symptoms. So I think medicine is meant for diversity.
Okay. Where do you see yourself in 10 years?
That's an interesting question. I think I have looked, I have actually thought about this, and my 10-year plan would be to be working as an endocrinologist, hopefully. And I haven't decided, like if I'm going to be married by then or not. But yeah, if I am, then hopefully, it's my family and my work is in a perfect balance that I would like to see it to be.
Okay. Do you have any questions for me, Dr. Shakeel?
Thank you for this interview, and I hope that you could learn a bit about myself. But I do have a question in mind. What can you tell me about how the residents are evaluated within the residency? Like, are there any in-training exams or anything?
Yeah, so we expect you to take the annual exam, the in-service exam, and we expect you to score at least more than 50% in that exam. If you're scoring less than 50%, that's a matter of concern for us. Ideally, our resident scores more than 60%, but we had that strict cutoff of 50%. Second, we do evaluate you on every rotation. We do a 360-degree evaluation. By that, I mean is you are evaluated by every person you work with, from the nurse to technicians to your senior residents, chief residents, attendings. Uh, we get monthly feedback, and we look over that, but we don't give you the feedback every month so that it's not overwhelming. So we give you the feedback on quarterly basis. You will have your meeting with the PD every quarter. In that meeting, your feedback will be presented to you, and then all the feedback is anonymous, including the ones you provide to others. Uh, yeah, that's so we have a 360-degree anonymous feedback. Did that answer your question?
Yes, it definitely did. Thank you so much.
Okay. Do you have any other questions for me?
No, most of my questions were answered.
Okay. Well, you did very good. Good luck for the match. Thank you.
Thank you so much.
All right, feedback time. What do you think, Reem? How did you do?
I think I did well.
Yeah, you did well. Yeah, you did well. So tell me something and be honest. Do you have any notes or sticky notes or something written on your left side?
Yes.
Okay. So don't do that. Don't do that. Please
Uh-huh.
don't put notes around you. You know, the
Okay.
problem is I could easily see I didn't know that you have notes or sticky notes or anything like that. I could see because you were looking at them and that made you a little
Mhm,
confused because you're not
mhm,
focused on the conversation a few times. You weren't
mhm,
focused on the answer, you were focused on your looking at your sticky notes. If
mhm.
if you can recall the answer, fine. If you can't recall the answer that you've decided, that's okay. Just say, okay, let
Okay.
me think about it. Let me take a minute, but it leaves a very, very bad impression when you're in the middle of an interview and you're like that your eye
Right.
contact gets lost, and like I could see that you have answers written. Not a good idea.
Mhm,
Um, Second thing is, when I ask you, tell me about yourself. Um, I'm trying to learn more about you professionally. That's not in your CV or personal statement. When you're starting your answer, I'm an IMG from Pakistan. Of course, you're an IMG from Pakistan. If you're a medical graduate from Pakistan, you're automatically an IMG, right? So I would rather say I'm a medical doctor. I'm or medical graduate from Pakistan, or that doesn't even matter. Honestly, in your case, what matters is I'm a person who's passionate about medicine, who wanted to go into medicine, like da da da, whatever you want to say,
mhm.
just say that, and then you can mention a little bit. Also, rather than just describing each and every one of your rotation and tell me about yourself is more about you rather than your rotations in America. Right? Just mention that, okay, and then my interest or passion for medicine brought me to US, and I worked as a medical student in US or for 3 months, and that further solidified my experience. Just give a hint
Right.
so that it flows, rather than just saying, "Okay, I worked there," because this is more about
Mhm,
you as a person rather than your rotations. So I'll say you can work on your tell me about yourself. Listen, it's very, very good. Whatever you have done, I would probably take you as a PD, but if you're trying to refine it and become better. One more thing that you did initially in most of your answers was you answered them good, your start was good, your ending was awkward.
mhm.
By that I mean is you're all of a sudden you will be like, yes, that's it, you know. So just say, thank you. Did that answer your question? Something like that. So rather than
Mhm.
saying, yeah, that's it. And all of a sudden your tone is much milder and weaker. So it shows that you're now more like whispering, okay, that's it. Ask me the next question. Just say thank you or ask, did that answer your question? Um, Only one more last thing.
Okay.
Um, Everything else was good. You had a unfinished sentences, and I think that brings us back to our previous discussions on fast talkers, fast thinkers. We are fast talkers, fast thinkers. Sometimes when we are thinking and talking at the same time, in our thought process, we have already reached to this other sentence. But our first sentence, we are not finished talking. So take your
Right.
time. Make sure you say a sentence, and once you're done with your sentence, you take a pause and then start the next sentence. I'm guilty of this myself. So just take your time, say a sentence, take a breather, then say the next sentence. You don't have to answer quickly. And answering slowly actually gives you more time to think. Okay. Other than that, you did very, very good.
Definitely.
It was a very good job. Any questions for me?
Thank you. Thank you so much. No, I think that I need to work on my technique on like delivering the answer a bit more.
Yeah, yeah, it was
And
very
yeah,
good. It's just these are the little minor tweaks that you need to do. Don't get disheartened in any way. You did very good. Your eye contact was perfect. Your smile was perfect. Your setup is good. So these are just very minor things. Okay?
okay. Thank you, Dr. Tariq, for the feedback. I appreciate it.
You're welcome. All right. I hope you all learned something from this video. If you did, please like this video, share it with others, subscribe to the channel, and like we always say, never give up, never lose hope. Bye.